Okay, hello everyone. You are very welcome to today's webinar in which we are looking at developing markets for sanitation, where to start. This webinar is co-hosted by the Stockholm Environment Institute, the Sustainable Sanitation Alliance and Beam Exchange. My name is Ruth. I work at WaterAid as Knowledge and Network Officer, and I will be hosting this webinar. The webinar will last for 1 hour. We will be having 2 presentations delivered by 3 presenters. Each presentation will last 15 to 20 minutes, and the remainder of the hour will be a question time. During the question time, participants will be invited to ask questions to the presenters, and your microphones will be unmuted at that point. Our presenters today include Aparajita Singh and Sanjay Singh from Population Services International in India, and Jan Willem Rosenboom from the Bill Melinda Gates Foundation. We will be starting with the presentation from PSI, so I will first introduce the 2 PSI speakers. Aparajita Singh is a senior specialist in advocacy and knowledge management at PSI in India. Her background is a rich mix of policy, research, consulting and practice, cutting across areas including WASH, the informal economy, collaborative governance and gender. Aparajita holds a Master's in Public Policy from the National University of Singapore and a Master's in Economics from the University of Pune. Sanjay Singh has worked in the WASH sector for the last 17 years. He started working with Population Services International as Sanitation Technical Lead in 2013, and currently he is Director of Programs and Sanitation Lead in PSI India. Sanjay is based in Bihar, where the project that will be presented is under implementation. So I will now pass over to Aparajita and Sanjay. Aparajita, you may start presenting.
Thanks for the introduction. So I will begin by providing a broad overview of the market development approach, or the MDA as we call it, that was adopted under the 3SI project. So 3SI stands for Supporting Sustainable Sanitation Improvements, and it's PSI India's flagship program in sanitation, being implemented since 2012 across 19 districts in the state of Bihar. It's funded by the Bill Melinda Gates Foundation. Additionally, Unilever's Domix Toilet Academy is partnering with PSI to primarily make sanitation financing within the project accessible to households and to sanitation entrepreneurs. So my colleague Sanjay would be taking you through the details of this project. What I would begin with and just try to give a broad overview is about the MDA. And what is MDA? How does MDA help? So this is a slide that we borrowed from a think tank called the Springfield Center, which is the main proponent of an approach called Making Markets Work for the Poor, or the M4P. I like this slide because it introduces the big idea in market development. So classically, even at PSI, we've thought that we best serve Sarah, who is the archetype of our consumer, a poor woman in the developing world who does not have access to health products and services, by following this conventional approach. So asking the question, what health problems does Sarah have, and how can we help solve these? So when we enter an intervention, we ventured from a problem lens. What is the promoted behavior that we want Sarah to perform? Why isn't she behaving, and what can we do to make her behave? What the MDA lens does is to enable us to take a step back and look at the market system wholly and comprehensively first, and foremost from the perspective of the consumer. So instead of inadvertently putting the blame on Sarah or the consumer, it allows us to diagnose the market failures that are acting as barriers to Sarah accessing or adopting the behavior. In sanitation, it would mean something like, what are the barriers to Sarah not being able to access the toilet or not being able to use it? So PSI's MDA defines the market to include players beyond the buyer and the seller. So expanding the consumer-producer binary to include indirect players to identify market failures and determining the most appropriate interventions needed to improve demand and supply, as well as the enabling environment to result in an equitable and sustainable healthy market. So how do we implement it? Where do we begin? And what does the steps look like? So at PSI, we deploy a 4-step process. Now, in no means this is supposed to be prescriptive. This is a guiding framework that we are sharing because something that we have curated and we found very useful in our work. It's basically an attempt to simplify the process, to diagnose and address the root causes systematically. So at step 1, we set the strategic framework. We ask the question, who is the market failing? At this stage, we consider potential consumers, total need for a product or service, and actual consumers, total use of a product or service in a market. Analysis of this gap through equity lenses such as age, gender, geography, wealth quintile, and risk behavior help determine who the market is failing among non-users and users. So in sanitation, it would look like the population that has access to toilets and is using it, and the population that does not have access and not using it. And what are the barriers for these, or what are the enablers for the ones who are using it? At step 2, we ask, how is the market failing? At this stage, we conduct a robust market mapping and landscape exercises to determine the key players in the relevant health market, the functions they are or are not performing, and how the enabling environment influences their capacity and incentives to perform. Subsequently, where do we work in the market? We determine this based where PSI is best positioned to further market development and design interventions to influence the incentives or capacities of relevant market players, as well as create a conducive enabling environment for overall market performance. So it doesn't mean that if PSI doesn't have the core competence to do it, we do not do it. Because if the landscape informs that these are areas that we intervene in, then we work with different partners, and Sanjay's presentation will bring that about how in PSI we work for different areas with different partners. And finally, how will we get there? So this is basically the monitoring and evaluation, how to track your progress throughout so that you have enough opportunity to course correct. This is not a linear process and it goes simultaneously, but it's more like a framework that we deploy. So what does success and challenges of implementing this process look like? To share our learnings from the PSI journey in Bihar, over to my colleague Sanjay. Thank you.
Thank you, Aparajita. So I will take you briefly through the geography where this project is being implemented. This project is being implemented in Bihar. So Bihar is one among the poorest states of the country. Around 104 million population lives here, and out of this 104 million, around 68 million still defecate in open, which is around 12% of the total population in India that defecates in open. So this was the small introduction of the geography where we are working right now. So as Aparajita mentioned, we had to adopt this market development approach to solve this sanitation problem in Bihar. So we try to understand how the market is working for the sanitation space. We did a landscape study, and landscape study informed us 3 key market barriers, and these were broken supply chain. The second was lack of access to finance. Third, consumer behavior. And you can see on your screen that this project was implemented, is being implemented in 19 districts in Bihar, and that is highlighted in green. Now come to the first barrier, that is broken supply chain. If an individual or a household is willing to purchase a toilet in a rural Bihar, he might require to interact with at least 20 actors, and there will be around 6 to 8 financial transactions. So, and every time when anybody wants to construct toilet, he may start, getting information from his neighborhood or the family. Then he can go to the different value chain players, and then he can come back to mason to get his toilet constructed. And this is good enough reason to discourage anyone to not to construct toilet. apart from this problem, there is another problem that people, neither supplier, service provider, and not the customer who is willing to purchase toilet is aware about a good quality product. What should be a product that he is required at his household. So when we started this product, we realized that toilet takes 69 to 70 days to be delivered at any household who is willing to construct at his place. At the same time, since there is no information about the good quality toilet, neither to the customer or anybody else in the ecosystem, they tend to have a deeper pit toilet or the septic tank toilet that costs around $750 US. Coming back to the broken supply chain, so there are different value chain players, and it is necessary to efficiently supply the toilet. We should have someone who could aggregate these facilities and efficiently provide this toilet to the willing customer. And under this value chain, there are hardware stores, there are brick manufacturers, and there are many cement retailers. But the problem is that all these value chain players get only 2 to 3% of their business from the sanitation business. So there is one enterprise, tiny enterprise, that is called as cement ring manufacturer. He is the only value chain player who gets his complete business from the toilet construction. So cement rings are being used for substructure of the toilet, for the containment of the toilet waste. But these cement ring manufacturers did not have a good experience while working with government and supplying cement rings. And at the moment we started, they did not have enough footfall to survive on this particular business. So they wanted to have a guaranteed return on their investment. So we tried to understand how these cement ring manufacturers are working in this space, what is their business model, what are the challenges, and their willingness to participate in this model. So and then we decided to have the cement ring manufacturer as the fulcrum of our business model. The whole idea of bringing these cement ring manufacturer and making them the fulcrum of this business was to efficiently provide good quality toilet to the willing customer. So in that space, the issue was that and they should have ability to provide all the information that a customer requires. So in this process, we identified different value chain players in the catchment of the cement ring manufacturers and linked these value chain players with this cement ring manufacturer. And we also know from many studies that quality of toilet has been our biggest deterrent in use of the toilet. So, and the good quality toilet could be provided through the masons only. And masons are very critical if they are not trained properly to provide such services to the willing customer. In that case, there is possibility that the toilet will not be used. So in this process, we also trained around 7,500 masons and linked these masons to the different enterprises across the 19 districts. The second barrier that was observed was lack of access to finance. So the study that we did in the beginning of this project, the landscape study, that informed us that around 6 to 8% of the population have some sort of liquidity and they could purchase toilet. But after the 6 to 8%, there is a 30% to 40% population who may not be able to purchase toilet, though they are willing, and they would require a sort of bridge financing. But the problem was that since this financing would require from 8,000 to 15,000 rupees. That falls under microfinance, and microfinance institutions were not very much willing to provide this sort of financing to the customers, because they believe that this is a non-productive kind of loan, and there is very possibility that they may not get repaid by the customer who takes that. So it was necessary to create a create a platform where we can demonstrate that sanitation financing can be done by microfinance institutions. So we identified an institution, that is Friends for Women World Bank, as a fund manager or wholesale lending agency, and infused around $1.2 million as a corpus fund to this entity. And it took us almost 6 months' time with a small microfinance institution to demonstrate that whatever loan is given to the customer can be repaid by them, and thus this pilot that took around 6 to 8 months, we gave loan to around 300 to 400 households. So after this demonstration, we were able to bring in more MFIs, and currently there are 6 microfinance institutions that are associated with the fund manager, and with this system we have been able to give 32,000 consumer loans and 251 enterprise loans. So if you see, by infusing $1.2 million, we have been able to mobilize additional $3 million that has been given as a consumer loan and or the enterprise loan. Next barrier that landscape studies informed us was the consumer behavior. So if you enter into any village and ask any person whether he is facing any problem while going for open defecation, he will certainly say yes and tell many things that he is going through the problem. But if you ask that he wants to construct a toilet, he will definitely say that he wants to do that. But immediately he won't be doing this. The reason is that open defecation in rural areas are a social norm, and that's why this construction of toilet falls at the lowest in their priority of need. So engaging with these people and converting them into real purchases is a difficult task. So that's why we thought that community engagement will be a better way where we can meet individuals or the community and motivate them to purchase a toilet. So, and since we are working in 19 districts, it wasn't an easy task. So we identified in each village a toilet motivator, and their job is to interact with the community, identify the willing people, and whoever is willing, then link that individual or the household with the enterprise and ensure that his toilet is constructed efficiently at the reasonable price. So currently we are working with 800 toilet motivators. They are spread across the 19 districts. They are only given incentive once the toilet is sold, and the incentive value is around $2.2 per toilet sold. Now, coming to the outcome of this project, as I mentioned that the cement ring manufacturer became fulcrum of this business model. So currently we are working with 752 sanitation enterprise. We gave them training, capacity building, and all that support that is required to remain in the business. And additionally, we had to ensure that they keep on getting their profit every month. The second is that we have been able to sell around 193,000 toilets, and if you see this graph, you could easily see that till the Q1 of 2006, the progress was very slow, and this could be matched with the number of enterprises that you've seen in the previous slide that then when the number of enterprises increase, the sale of toilet also increase. Out of these 193,000 total toilet that has been sold, 45% of the toilets are sold to below poverty line household. So the definition of below poverty line household is a bit contentious, but for simply, I would just want to simplify this and say that a family of 5, if earns less than 6,000 rupees or $80, could fall under the category of below poverty line. Apart from this, we also observed how these toilets that has been sold are being used. So during last year of the project implementation, we brought output tracking survey that is being done every after 4 months, and we did so far twice, and the third is going on. And from that, we found that 92% of the toilets that has been sold in the project geography is consistently used. And the definition of consistent use is there on your screen, which is at least 2 members of household use sanitation facility every time in last 3 occasions. Now coming to the outcome in terms of sanitation financing. So far around 33,000 consumer loans have been given and 251 enterprise loans are provided. If you see this graph, you can understand the hardship that we went through, because we started in Q1 of 2014 and it took us almost 2 years to reach where we comfortably started giving loans to the consumer. And this time we invested in identifying the wholesale lending agency. Then as I mentioned earlier, it was very difficult to bring in microfinance institution, and bringing in 6 microfinance institutions, it took almost 1.5 year time. And after that, it's slowly moving upwards, and the number that I mentioned that we have reached to that level. Now, the last slide which is very interesting also, that I mentioned in my previous slide, that when we started the delivery of the toilet, the time taken for delivery of toilet was around 70 days. So over a period, by bringing in capacity to the cement ring manufacturers, by linking the different value chain players with these cement ring manufacturers, and placing in the standard operating procedures, the toilet delivery time reduced from 70 days to almost 14 days. Last, that we want to thank the Bill and Melinda Gates Foundation and all other partners who supported us in reaching to this space. Thank you very much.
Thank you very much, Abhijita and Sanjay, for that very interesting presentation. There's been quite a bit of discussion already started in the chat box, but we are going to first move to the second presentation, and then we'll take all the questions at the end. So our third presenter today is Jan Willem Rosenboom. Jan Willem is a Senior Program Officer in the WASH strategy for the Bill Melinda Gates Foundation based in Seattle. Jan Willem co-manages the Measurement, Evaluation and Dissemination for Scale initiative under the WASH strategy. This covers a substantial grant portfolio including investments in market research and market making, policy development, business model development and knowledge management. Jan Willem has over 30 years of experience in international development, primarily in the field of WASH. So over to you, Jan Willem.
Thanks very much, Ruth. I hope my sound still works. What I'm going to do is very quickly in this presentation go over sort of the general approach we used in the sanitation market development investments that we made. And while they're all unique, a lot of the lessons and a lot of the experiences on the supply side and the demand side are very similar to the insights you just heard from PSI in Bihar. So I'm going to try to skip over all of that rather quickly and sort of get to some of the insights we pulled from the investment, in the hope that we can spend most of the time remaining on further discussion. And very quickly, the intent of our service delivery model investments, which was a phase in the program where we invested in CLTS, we invested in marketing, we invested in the combination, we kind of called CLTS++. And the intent of all these investments was to discover or to develop delivery models that worked at scale, had demonstrable impact on a range of outcomes, and gave sustainable results, both from the household perspective and in the market case from a business perspective. And although there are different ways you can sort of slice and dice the focus of these various investments, because not two of them were the same, all of them included the three elements that you see in this slide. You focus on improving the enabling environment, increasing demand, and improving supply chains, and ultimately linking supply and demand more seamlessly through the implementation of the program. And I'm assuming that everybody understands what I mean when I talk about enabling environment, which is on the one side the policy and regulation you have in the sanitation sector, things like quality assurance of production, financing, delivery, encouraging private sector participation, consumer uptake, things like that. And on the demand side, there is the closest focus on the consumer, demanding materials and services, making use of promotions that are offered by the program, and the supply chain interventions are aimed at delivering competitive products and services for the customers. And then you have the role of what in the last presentation was PSI, which in some of the other examples that I'll come to was IDE, or WSP, or the Thrive networks. Like, what is the role of the civil society actor, the NGO, filling gaps, at catalyzing markets and demand, in certain cases being the market maker and loss leader. One of the examples that PSI gave is also who pays for the promotion and the demand creation, which in this case at this moment is PSI, but in a sustained market-based model you would hope that to be the natural owner of that process, which can either be government or private sector. But as you develop these models, being the organization that carries that cost is a natural role. And bringing the market to a point where the private sector actors are incentivized to actually jump in and join. And we saw some interesting developments on that in Cambodia, I'll get to in a moment. And then, as you heard in the previous presentation as well, building the capacity of private sector actors, ability to access finance across the value chain, and ensuring collaboration between different organizations and a mutually supportive approach. And in doing this, investing in these market development opportunities, we had a number of questions we were trying to answer portfolio-wide, and I'm not going to get deeply into them, but I wanted to share upfront that there was a clear understanding of knowledge gaps that we had in the sector that drove our decision making, where research and learning were involved, and when we made these market making grants, and that was across all our investment, not just the sanitation marketing ones. So coming to the general approach, and this will look similar to what PSI just talked about, so I'll go really quickly, but it is, I think, important. Each project was different in timing and detail. Yeah, if we look at the IDE scaling up market sanitation market project, that was built on a deep understanding of what worked from a pilot phase that had already been completed before the foundation decided to invest. But if you just heard PSI started from a situation where it was much less well understood what was possible in the environment of Bihar. So this idea of ensuring that you understand the environment, studying demand and demand constraints, and studying the supply chain and supply constraints is really important, and then integrating the insights from that in what leads to the design of the market development program. It's like if you don't have that information to start with, it will be really difficult to build a successful program. And if we then look at what actually happened in most of the market development programs that we implemented, you end up with demand-side interventions, advertising and promotion campaigns, local latrine sales agents as used in Bihar and other places, enabling environment interventions around credit, microfinance, in some cases revolving funds, supplier credit around tools, supplies, transport, stock, and linking interventions with local efforts around behavior change campaigns that may be implemented by others or by the government, subsidies that may be available. This is an interesting case in India with incentives available to all the household, work that's done through self-help groups and promotion, things like that. And supply-side interventions that focus on identifying, enlisting, and supporting suppliers, and in many cases product development. Not in all, but I'll get to that in the lessons a little bit more as well. And building up a supply network that links supply and demand. And doing things this way reinforces the concept that when you try to solve sanitation problems, you deal with the whole system, with the what Sanjay called the ecosystem level, and not just the enterprise level. And you understand why market failures exist in the first place, why are there no existing actors that are providing these goods and services, and how that interacts with consumers, with government, and the dynamic relationships that exist. The end goal of that is to achieve a state where customers can access desirable products and services at an affordable price, enterprises are selling products and services at sufficient profit for them to continue providing these products and services in the long run, and the overall environment supports the efficient functioning of the market. And if you look at what we found through all the market development projects that we implemented, again, I should say, well, the landscaping approaches and findings were different in each country, yet there's a lot of similarities in sort of themes of issues that emerge from our work in a range of different countries. And you've heard some of those from Sanjay. On the demand side, a really complex purchasing process in many cases that involves many steps and a long time. The particularly in India, is then made more difficult with claiming the incentive at the household level. But even where you don't have that, it's not uncommon for consumers to have to engage with 4 or 5 different businesses or individuals. High prices, no supplier or no delivery to the household level, and in many cases an inherent lack of trust in the supplier as a source of information, as a source of reasonably priced goods, and that make it difficult to complete the transaction. Cash flow constraints on both the supply side and the demand side, and this idea that in some cases there's no real demand for sanitation. Again, a strong example of that in India, where it can wait. So how do you incentivize a supplier to actually overcome those kind of constraints? On the supply side, some really common findings: low business skills, this idea of being a low volume, high margin supplier versus a high volume, low margin supplier that could potentially make you more money. A reluctance to produce products for which there is low demand. Skepticism about consumers' ability to pay. And the fact that toilets for many, and take the cement ring manufacturers as an example, it's one product in a larger line of business, and actually constructing toilets can be deeply unattractive because it takes time, it's a slow process, driving up the cost, and so we have experience in some areas where it's even difficult to find suppliers that would even be willing to do that, unless in areas in the time of the year where demand for other products is really, really low. And then other issues like a really passive sales approach, reluctance to invest in marketing and advertising, and comes back again to that question. It's like, well, who pays for that demand making? And also for the suppliers, lack of credit, and also a reluctance to look for it. So overall, you have lots of mismatches between supply and demand, and the intent of these programs we looked at was to bring the two closer together. So let me really quickly look at some of the investments we made that I used as examples, one of which comes out of the early learning phase of the strategy. It was sort of 2007 to 2010, which is the total sanitation and sanitation marketing work that we funded in India, Indonesia, and Tanzania. And it's the only project I pulled out in this example that combined CLTS and marketing in one program. TSSM, the name already clarifies that. Over the time of its implementation, served 8.3 million people, although that's mostly through the CLTS part of the program, because the marketing component was much delayed, and it informed the national STBM Indonesia sanitation program. It was a program that didn't go live or included subsidies, and closed in 2013. Next up was the Scaling Up Sanitation Marketing Program that we implemented with IDE in Cambodia for 4 years, and what we funded was the scaling up phase following a successful pilot that developed the Easy Latrine, which some of you may know, which is a product and an associated business model. And over the 4 years of its implementation, reached 1.3 million people, completed in 2015, and IDE is currently looking for ways to see how this can become a self-sustaining model in Cambodia. The program we started the same year as the IDE work is the Community Hygiene Output-Based Aid, OBA 1 program, which we supported with East Meets West, now called Thrive Networks in Vietnam. And what was unique about that program is that payment to the implementer was 100% based on payment by results, and implementation relied on leveraging the Vietnam Women's Union presence throughout the country. There's a second phase of the program currently ongoing called CHOBA 2, looking at how this CHOBA 1 model can become self-sustaining and independent of funding from external agencies like the foundation or others, and currently has reached 0.8 million people, and the current work will continue for another 2 years. And it's one of the programs that included rebates to poor families, so a form of small subsidy that influenced demand for the product. And then the 3SI project you just heard about, so I won't have to summarize that again. A couple of things overarching from these projects. As you will see, that with the exception of the TSSM program, all of them are focused in South and Southeast Asia. All did well on the scale component of what we were looking for in our investments, although the cost of delivery, as far as we can determine from these different programs, is very, very different among all four, even though it is hard to measure exactly, because some of these investments, like TSSM, leverages government investment and others don't. Some of these programs, again, like TSSM and the work with IDE, includes research costs and others don't. So figuring out who pays what is hard, but even so, there's an order of magnitude difference between sort of the cost per person reached through these programs. But I should stress that what does it cost question has not been answered in full through any of these programs. The question of sustaining the model is really interesting, and I'll get to that in the next couple of slides. Let me go through some of the lessons before we completely run out of time. So one of the things I should say is that none of the projects so far has established completely independently operating markets yet, right? PSI is still ongoing in Bihar, and we're looking for ways to help that sustain. CHOBA in Vietnam is looking for a sustained model, as is IDE. And one of the things I want to pull out also, again, not just from the marketing work, but work in general, is that this idea of working at scale means understanding the whole environment in which you work and how to work in it. And whether that is leveraging resources from the government or policies from the government, or whether that is leveraging staff, health workers, district health facilities, things like that. And demonstrating that scale is possible is not the same as scaling up a demonstration. And all of these projects have struggled and prevailed in figuring out how to leverage the system and reach scale, and figuring out how, demonstrations at a smaller scale, they're more expensive, they make use of better staff, can make use of high government motivation or skill in a small area, and can build their own monitoring systems, etc., and making the transition to a sustained model and reaching scale in spite of things not all being ideal has been the true learning journey for a number of these projects. And I think part of that look, the taking that systems view of what it needs to be successful, in part explains or justifies the fact that we would spend charitable funds on doing that, in creating a public good in working markets, stimulating demand, developing better technologies, and maintaining that over time. As you heard earlier, our market development efforts in India showed about 45% of sales to the poor. In Cambodia, about 27% of sales to the poor without incentives or subsidies. And our work in Vietnam, and also our work in Bangladesh, which is not summarized here, has shown that it is possible to target subsidies to the poor and to administer them in a way that doesn't undermine the market, which is a criticism that's often thrown at subsidies. For example, through using vouchers exchanged for materials in the market, and vouchers by themselves not having any additional value. So reaching the poor with and without subsidies has been possible, even though that doesn't answer the question of how do we reach whole communities and everybody is there. A final observation about selling to the poor is that it is incredibly important to understand what it is they want. The poor have aspirations just like the rich do. The poor do not necessarily want to be identified as such by the products that they buy. And a great example from that is not out of sanitation, but out of work that was done also by IDE on water filters in Cambodia, designing a more beautiful aspirational model that was much more expensive than the cheaper model, even though the internal working of both filters was the same. The more expensive one outsold the cheaper one 7-1, even among the poor. And so understanding the aspirations and wants is really important, no matter who your customer is. Define success carefully is another lesson that I can't overstress, and I can't overstress the importance of monitoring outcomes. Because if you want to monitoring outcomes, that means you need to be really clear about what success looks like. Is it the number of toilets sold? Is it the number of toilets used? And if that is the case, how do you actually define that? And how do you measure that? Is it the number of poor people reached? They're incredibly important questions to struggle with up front. And in market-based systems, it's especially important to look at business incentives. Selling to the better off and moving on, so picking the low-hanging fruit, would be sort of a natural comfort zone for business. And selling to the poor takes more effort and thus more expense. And if you work on if as a foundation I fund a program by PSI or IDE or someone else, I can influence that kind of behavior as a funder by incentivizing sales to the poor. And we did that, for example, by making outcome-based payments that were higher for sales to the poor than for sales of just any toilet, but in a system sustained outside of that kind of external financing, it'd be much harder to drive that focus, where you then need to start answering questions about the role of government subsidies, the use of particular OBA approaches in services that are financed to the government, for example, can all address this, but you need to bring intent to the question and to the ways you try to solve it, and understand the limits of a naturally sustained system versus a funder sustained system. And it takes time. Getting to success takes time and measurement and change. If we look at the Cambodia program, the understanding of how the business model worked had been established through a pilot program, and it was possible from the start to design a scaled implementation with some great accuracy based on that earlier pilot. PSI in Bihar started in an environment where nobody knew anything about what was going to work, and early projections of what was going to work were incredibly optimistic, looking back. It took a long time. Yep. Oh, okay. I'm at my last slide. So last two sentences. So this long time of incredibly slow progress eventually got us to success. So what next? I'll leave that up while we answer some questions. We still don't know much about the cost of delivery. Self-sustaining business models I've talked about. The final one I really wanted to call out is that this idea of making impact has been elusive. If we look at the TSSM program on all kinds of measures, it was very successful in reducing diarrhea, decreasing ODF, decreasing stunting. The government has taken it up, but recent measurements have shown that the program taken up by the government does not show the same impacts. So this whole question of how do you take a model and actually successfully transition it to a sustained model with the same impact is also still an open question. All right. Sorry for taking so long. You have about 10 minutes left for questions.
Thank you very much, Jan Willem. We will now invite questions from participants. So if you would like to ask a question using your mic, please select the raised hand symbol at the top of your screen so that just to let me know. Otherwise, in the meantime, I will start with some of the questions and comments that have been entered into the chat box. So we had a question from Dick that was originally for PSI, but Jan Willem had also responded a bit on that. The question is, you've mentioned that sanitation loans were considered non-productive. That should be correctable. Could you get an estimate of time loss for sanitation-related illnesses and the economic impact of that loss? My guess is if the study was undertaken, it would justify the loans. The response from Jan Willem, the gains are economic rather than financial. And then again, a question back from Dick, can economic gains be translated into financial gains? So I just wanted to open that up to all of the presenters.
I think they're very different things. I'm not an economist, and I'm sure we have some people with better understanding in the audience actually. But what for a household makes sense is healthcare expenditure, income, and while you can probably model economic losses and financial gains or financial losses, it wouldn't easily be experienced that way by a household. If I have 5 kids and they have diarrhea every now and then, I have to take them to the doctor, and now I start using a toilet. Well, maybe that gets a little bit better, but there'll be all kinds of other things in the environment that may still make them sick. So to say you can directly translate the fact that I now have a toilet to the fact that I spend less money as a household would be incredibly difficult to measure and incredibly difficult to actually do anything useful with, and then to use that for a microfinance institution that just looks at, are you going to be able to pay back that loan? So I think that it's probably in different mechanisms that you can stimulate these loans rather than trying to figure out what the financial impact of a toilet is. I like to think of setting up a guarantee fund, as is done for other sectors sometimes, or there's other mechanisms.
Thank you very much. There's another follow-up comment here from Dick. As an agronomist mostly concerned with crop management, any time lost for sanitation illness would have an impact on income and food security. I recognise it's indirect, but I think it's a valuable one. Another question here, which I'll open up to all presenters, from Nancy. I'm curious about MFI's experience with repayment of sanitation loans. Do you think it's important to have a tech solution to repayment, for example, using cell phones, or are traditional methods okay? Also, how do you incentivize repayment?
Okay, I can perhaps respond that. So I think there are two parts of that question. One is just about the incentive of payment, why are households paying, and the second is more about the monitoring and can we use technology-based monitoring. So on the second piece first, I think MFIs are already using some of these different MIS technology-based tools. The challenge that we faced in when we were working with MFIs was to marry their MFI systems, which were catered to tracking repayments, to ours, which was more about ensuring that the toilet was constructed. So that has taken a lot of time, and that's the challenge, because for health outcomes to be achieved, the toilet needs to be constructed and used, whereas the interest for the MFI to some extent ends with the loan repayment happening regularly. In terms of defaults, at least from the experience in Bihar, we haven't, it's been almost 100% repayment across the 6 MFI partners that we are working with. Coming back to the first question, what is the incentive for households to pay? And I think this has been deliberated, there's been a lot of studies, some studies that have happened about the willingness to pay, what is the evidence about repayment, because even with the experience, the ups and downs of the MFI just overall in India, we saw that repayments remained high, but then suddenly we saw these cases of defaults and so on, so forth. I think one of the major incentives is that they understand that if this is a credit source that they default at, they are not going to be able to get any more borrowing at the rate that they are getting. And particularly for sanitation, there are not many MFIs that really are loaning out. The second is that some MFIs have actually worked out mechanisms where if the sanitation loans are not being paid, they convert it to an income generating loan where the interest rates are higher. So your risk to default is very high because you are currently getting a sanitation loan for a lesser interest rate. But if you default for a couple of times, your loan is converted into an income generating loan. So it's more on a case-to-case basis. This is still where we are learning. It's relatively new, and I guess we really have a long way to go to move to something like more sophisticated where we have enough evidence.
So I'm going to add to that. I agree with everything you said. I'm going to add to that so that then possibly explains there is in India a microfinance institution that was only providing loans for toilets where repayment rates were lower, and that then suddenly becomes logical, because if that loan is paid off, you're not going to get another loan from the same microfinance institution. So the risk of non-repayment becomes lower from that perspective. And I don't know whether that has been fully understood yet, but it seems to point to this idea that if you have microfinance institutions that only focus on one product, that would actually increase the risk to the business.
Thank you very much, both of you. A related question for PSI from Wycliffe. Are the MFIs that you mentioned charging their preferred rates for sanitation loans, or is the interest rate capped?
Okay. Sanjay, okay. So, because it's a market facilitation project, our approach is to not really, influence the market mechanisms. But as Jan Willem was explaining, that a lot of these MFIs who have come into giving out loans for sanitation, they see the value proposition, given that there is a big volume that is unserviced by financial for sanitation. So the interest rates are lower than the income generating loans, typically around 3 to 4% lower than a standard income generating loan. PSI really does not have a role, or we do not set that this is going to be the rate of interest. But if it is not lower than the income generating loan, there is no incentive either for the consumer to borrow or for the provider to give it at a lower rate. So at some level, initially when we infuse the money, we have subsidized that access to credit for the fund manager and the MFI at source. So initially through the project, $1.2 million was infused to set up the sanitation finance model, and that is why initially the microfinance partners were able to give out those loans at a lower rate and learn that this is being repaid, and now it has become more part of their portfolio. So
I'm sorry, go ahead.
Yeah, to some extent the support or the subsidy or was done at the source, which automatically led to the market, organically moving and deciding the right rates. Yeah.
And I'm not familiar with any. Capping interest rates is normally the province of regulatory institutions or government. There's lots of contradictory evidence on the desirability of doing that. I'm not familiar with any of the governments in the countries who are doing that. But if we look at the work with EMW in Vietnam, where many households borrowed money to buy a toilet, the poorest would get a rebate, it's paid for by the government actually, and the poorest could also get in a sense, a subsidized interest on the loan through the Vietnam Bank for Social Policy. So in a way, it was a government effort to support a social program that benefited the poor, and you still had to pay interest, but it was lower if you qualified for that. And the rebate that was available for the toilets, in a way, could also be construed as saying, well, it's not a big amount of money, but it pays for the interest on the loan repayment. So it's almost like getting a discount when you buy a toilet.
Okay, thank you very much. Because we're over time, I'm just going to put maybe one more question to each of the presenters, but for everyone that may be starting to leave now, I will post the link to where the questions that you've typed into the chat box that have not yet been answered, we will move them over onto the SuSanA forum, and we can continue the discussion there afterwards. So I'll just do that now. And final couple of questions. We've got a question for Jan Willem. In your experience among the programs you mentioned or other projects you're aware of, has anyone had success motivating retailers to offer flexible payment plans to customers in the absence of microfinance access?
Not that I'm aware of. I do know there is a lot of work that has gone on, particularly in Cambodia, working with microfinance providers in designing particular products and in designing repayment schedules that would sort of maximize things on both ends. You sell as many, you reach as many of the poor as you can, and you make it an interesting business for the microfinance provider. But this idea of flexible repayment, not structurally. It may be that a microfinance provider reschedules repayment or lowers repayment and lengthens the time, but it's not an upfront feature of any of the products that I know of.
Okay,
but it's an interesting question, and actually getting to the point where you, in a sense, cut out the microfinance provider and say, I just get my loan from my toilet provider, may make things easier for the consumer, right?
Great, thank you. And then a question about the PSI project in Bihar from Nazava. What is the duration of repayment of the loans?
So, so far there has been no default. All those 32,000 loans that have been given to the consumers, they are repaying their EMIs. There has been some shift in dates, but otherwise there is no default. And in terms of enterprise finance, that has been given to 251 enterprises, that is also, there is no default so far.
Okay, and what is the kind of average time then that it takes households to pay back the loans?
So it's 1 year time.
Okay, great.
So they have to pay EMIs every month, and the value of EMI varies from 1,200 rupees to 1,500 rupees per month.
Okay, thank you very much. Okay, well that brings us to the end of the webinar today. I would like to thank all of the presenters for the excellent presentations, and as I mentioned, hopefully the presenters will assist us in answering the outstanding questions via the SuSanA forum. The link is posted here in the box. Thank you also to all of the participants for joining us and for asking your questions and engaging.
Thank you.
Thanks very much.
Thank you very much.